Hello everyone, in this video we are going to discuss about a gynecology topic called contraception. Definition: the term contraception will include all the measures, temporary or permanent, designed to prevent pregnancy due to coital act. So guys, what is contraception? The measures taken by the person, whether it is a temporary method or a permanent method, to prevent the pregnancy which is occurring because of the coital act. The measures taken to prevent pregnancy is contraception. Temporary methods are commonly used to postpone or to space birth. When you want to have a space between the pregnancies, between one child and the other, you use this temporary method. Or because of some personal reasons or some other reasons, if you want to postpone your pregnancy for few years, you use temporary methods. It is used to postpone the pregnancy or to space birth. However, the methods are also frequently being used by the couples even though they have got strong desire for no more children. So couples who have thought of not having any more children, but then who have a strong desire for not having children, yet use this temporary method and do not go for permanent sterilization, because there are more complications in that. People opt for temporary methods. Methods of contraception could be temporary method and a permanent method. Under the temporary method, we have barrier method, natural contraception, intrauterine contraceptive devices, steroidal contraception. So guys, you see here, there are barrier methods. The barrier methods could be the mechanical devices such as cervical caps, diaphragms. Then we have natural contraception, withdrawal method and so on, which will be discussed in detail in the next slides. Intrauterine contraceptive devices and steroidal contraception. These are the temporary methods. On the other hand, we have the permanent methods. In the females, there is tubal occlusion, and in the males, there is vasectomy. Barrier methods. These methods will prevent the sperm deposition into the vagina. So guys, you see here a barrier is formed, an obstruction. What is this doing? It is preventing the sperm deposition into the vagina, or it is preventing the sperm penetration through the cervical canal. So it does not allow the entry of sperms into the cervical canal. It is going to prevent the sperm's deposition in the vagina. What are the objectives? It is achieved by mechanical devices, chemical means which will produce sperm immobilization, and combined means. The barrier methods, how do you achieve a barrier? It is by the mechanical devices. The mechanical devices could be the cervical caps, the diaphragms, and the chemical means, that is in the form of foams, tablets, creams, jellies and so on. What do? They will produce the sperm immobilization. Immobilization is what? It is preventing its movement. Further progressive motility of the sperm is stopped. So it is producing sperm immobilization. And also there are combined methods. The mechanical method, in the males it is condom, in females it is condom, diaphragm and cervical cap. The chemical methods, the vaginal contraceptives will be the creams, Delphin, Nonoxynol 9, 12.5%, jellies, Coromex, Volpar paste. Foam tablets are aerosol foams, Chloramine T or Contab. Sponge today. Sponge today is the most popular one. So you need to remember, in chemicals it is creams, jellies and foam tablets. Combination is a combined use of the both mechanical and chemical. Okay? Like applying the cream, applying the jelly on the diaphragm. So it's like combining the chemical method with the mechanical method. Let us discuss in detail the condoms in male. They are made up of polyurethane or latex. The composition, the condom, it is made up of polyurethane or latex. The most widely practiced method used by the male. So condoms are the widely used methods by the males. In India, one particular brand latex is widely marketed as Nirodh. So in India, there is one popular brand which is given by the government of India. It is Nirodh. Let us move on to the female condom, that is femidom. It is a pouch made up of polyurethane. You see the picture here? It is made up of polyurethane which lines the vagina and also the external genitalia. The length of a female condom is 17 centimeters with one flexible polyurethane ring which is attached at each end of the pouch. So what is a female condom? It is a pouch. The pouch is 17 centimeters long. It is made up of polyurethane. It is lining the vagina and the external genitalia. It has one ring at each end. Diaphragm. It is an intravaginal device made up of latex with a flexible metal or spring ring at the margin. You see guys, the picture here, it is a intravaginal device. It is made up of latex. It has a flexible metal ring or a spring ring. At the margin, you can see the margin is containing a ring and it is flexible. The device is introduced up to 3 hours before the intercourse. So you need to introduce the device 3 hours before the intercourse, and it is to be kept for at least 6 hours after the last coital act. So after the coital act, it has to be remained in the vagina for 6 hours. Even after the intercourse, it has to be there for 6 hours. So guys, what is the diaphragm? It is an intravaginal device. It is made up of latex. It has a flexible metal ring or a spring ring which is at the margin. First thing you have to do, introduce it 3 hours before intercourse, and it has to be kept for 6 hours after the last coital act. Guys, you see few people, these polyurethanes in the male condoms, it is made up of polyurethane or latex. Why do we use, why people don't use latex is because few people will be sensitive to the latex rubber, whereas the polyurethane condoms will be thinner and it is suitable for people who have like sensitivity to latex. Whereas this females, we have female condom like like the femidom, which is made up of polyurethane, and the diaphragm, which is made up of latex. So we have both the things here. Guys, you see here what happens. The diaphragm, it will fit over the cervical opening and it will prevent the sperms from entering the uterus. You can see here it is folded and it is inserted, and then it is going to fit over the cervical opening. By fitting over there, it will prevent the sperms from entering the uterus. The spermicide which is present inside the diaphragm, it is going to kill the sperms. So what we have to do, first place a spermicide in the cup at its rim, then we have to fold and insert it into the vagina. After that, we have to make sure that the cervix is the diaphragm is fitting the cervix and it is behind the pubic bone. You can see it here. Hope the diaphragm is clear, guys. What's happening here? It is a device, intravaginal device. It is made up of latex. It has to fit the cervix. What does it do? It is going to prevent the sperms from entering the uterus. This is how it acts as a barrier method. Vaginal contraceptive spermicides are available as vaginal foams, gels, creams, tablets, and suppositories. You can look in the picture here. The foam and the applicator, the vaginal suppositories, tablets. Vaginal contraceptive sponge, today, it releases the spermicide during coitus, absorbs the ejaculate, and blocks the entrance to the cervical canal. The same function, what it is doing here. In fact, this today is the most popular brand of sponge. It is going to absorb the ejaculate. Here you can see the ejaculate. The sponge is going to absorb the ejaculate, and thereby it will block the entrance of the sperms into the cervical canal. The sponge should not be removed for 6 hours after the intercourse. Same like in the diaphragm what we read, it has to be kept on at least for 6 hours. In the same way, the sponge should not be removed for 6 hours after the intercourse. Advantages of condom. What is the advantage? It is cheaper. There is no contraindication. First thing, condoms are cheaper. They have no side effects. They are easy to carry, simple to use, and they are disposable. They have a protection against the sexually transmitted diseases. Example, the gonorrhea, chlamydia, human papilloma virus, and HIV virus. So you see the condoms are cheaper, they do not have side effects, they are easy to carry, they are easily disposable, they are very simple to use. Even the layman's can use it. It's not like a very hard technique or a procedure. They are simple to use, they are easily disposable. They also give a protection against the sexually transmitted diseases like the gonorrhea, chlamydia, HPV, HIV. Then they also give a protection against the pelvic inflammatory diseases in women. They reduce the incidence of tubal infertility and the ectopic pregnancy in women. Along with the PIDs, they also help to reduce the tubal infertility and also the ectopic pregnancy. They also provide a protection against the cervical cell abnormalities like the cervical intraepithelial neoplasias. They are useful when the coital act is infrequent and irregular. So guys, you see, these condoms can be used when your coital act is very infrequent and it is irregular. These are the advantages. It is cheap, no contraindication, no side effects. They are easy to carry, easily disposable, simple to use. They give protection against STDs, PIDs, tubal infertility, ectopic pregnancy, and cervical cell abnormalities. Now let us move on to the disadvantages of condoms. They may accidentally break or slip off during the coitus. So these condoms can break accidentally and resulting in unwanted pregnancies. They also slip off during the coitus. Inadequate sexual pleasure, allergic reaction. I told you few men will be allergic to latex rubber, so they go to the polyurethane condoms. So few men will be allergic to latex. Allergic reaction can be seen. To discard after one coital act. So it's not reusable. Few condoms have to be disposed after each coital act. Failure rate is 15%. These are the disadvantages. Now we move on to the natural contraception. Fertility awareness method. These are the natural. We are not using anything like extra thing here. It's natural. These methods. Fertility awareness method. It will require the partner's cooperation. The woman should know the fertile time of her menstrual cycle. For the fertility awareness method, we are starting what happens. The woman has to know the fertile period of her menstrual cycle. Then it also requires during that fertile period she has to abstain from sexual intercourse. For this abstinence, she requires the partner's cooperation. This is what they are saying here. First, for the fertility awareness method, the woman needs to know her fertile period, needs to have an abstinence for sexual intercourse during this particular period of time, and it requires the partner's cooperation here. Starting with the rhythm method. This method is based on the identification of the fertile period of a cycle and to abstain from sexual intercourse during that period. This also requires the partner's cooperation. So the fertility awareness method, starting with the rhythm method, you see guys, this is the chart how the girl can maintain or the woman can maintain. By this she can figure out her fertility period, the most fertile period of her cycle, and she has to abstain from sexual intercourse during that period of the month, and it will require a partner's cooperation. So you require the partner's cooperation in that. You see, first 7 days of her menstrual cycle, she is infertile. Then from 8th day to 19th day, she is more like the fertile period. This is the fertile period. In that, the most fertile is only these particular days, 11 to 16. These 6 days are the most fertile periods. In the rest, this is semi-fertile. This she is infertile. So this is the safe period. Infertile period is a safe period. So first 7 days she is infertile. Then from 8th day to 19th day, the fertility period. 20th to 32 or 26. It depends on each girls. So every girl it will be different. Every woman it is different. Accordingly, using a chart or a cycle, she has to calculate her fertile period. And she has to abstain from sexual intercourse during that period. The methods to determine the appropriate time of ovulation and the fertile period will include. Now, how does the woman know what is her fertile period? How does she determine this is the time of ovulation? To determine this, there are few methods. that is recording of the previous menstrual cycle by calendar rhythm. So in the calendar she can mark the like her menstrual cycle when it is occurring, the first 7 days, and accordingly she can calculate her fertile period. Recording the previous menstrual cycle by calendar rhythm. Noting the basal body temperature chart. So what happens, basically we have read in other chapter, the previous chapter of infertility. Here again I am going to tell you the basal body temperature, what the woman does before moving out of her bed. Every day she is going to record the temperature. On the day of ovulation it is going to fall by 0.5 degree Fahrenheit. Following her in the first 14 days it is normal. On the day of ovulation 0.5 degree Fahrenheit it is going to fall down. Following her ovulation it is going to rise by 0.2 to 0.5 degrees Celsius. This rise in temperature to 0.2 to 0.5 degrees Celsius will make her determine the fertility period. So noting the basal body temperature chart by temperature rhythm. Noting excessive mucoid vaginal discharge, this is the mucus rhythm. So the changes in the mucus which occur according to the changes in the menstrual days, this also can be helpful in determining the fertile period. Fertility awareness methods, like we saw the rhythm or calendar method, basal body temperature method, and the cervical mucus method. Coitus interruptus or withdrawal method, it is the oldest and probably the most widely accepted contraceptive method by the men. So the coitus interruptus is the most widely accepted method which is used by men. It necessitates the withdrawal of penis shortly before ejaculation. What happens? The man has to remove his penis before the ejaculation. There is withdrawal of the penis before the ejaculation. It requires a lot of self-control and everything. So this method is most widely used, but then it's the most safest method which is mentioned in the the Catholic Church, and this is the only method which is taught in religions. So many of the religions follow this method rather than the barrier methods and so on. Breastfeeding, lactational amenorrhea. This is the most effective in women who are amenorrheic than those who are menstruating. So guys, this breastfeeding lactational amenorrhea, this method will be effective in the women who are amenorrheic than the women who are breastfeeding but they are menstruating. More effective in the women who are amenorrheic. The risk of pregnancy to a woman who is fully breastfeeding and amenorrheic is less than 2% in first 6 months. So you see, a woman who is breastfeeding, along with breastfeeding, she is amenorrheic. In a woman who is breastfeeding, fully breastfeeding, and she is amenorrheic, the fertility is less than 2% in the first 6 months. So the chances of becoming pregnant in the first 6 months is just 2%. When the woman is fully breastfeeding, a contraceptive method should be used in the third postpartum month. So you see they are saying about a fully breastfeeding woman, which means a woman is breastfeeding her child 5 to 6 times a day, and it is consuming 60 minutes of her 24 hours. Then it means she is fully breastfeeding, and she has to use the contraceptive in the third postpartum month. Following the delivery, from the third postpartum month, she have to start using contraceptive. Whereas the woman who is partially breastfeeding or she is not breastfeeding, she has to start using contraceptive from the third postpartum week. You see the difference here? A woman who is fully breastfeeding and she is amenorrheic, third postpartum month. Whereas the woman who is partially or she is not breastfeeding, she has to start using it from the third postpartum week itself. Let us move on to the intrauterine contraceptive devices. This device is classified as open device or a closed device. The device could be, that is the intrauterine contraceptive device could be non-medicated such as Lippes loop. Medicated is bioactive. Hormone containing intrauterine devices, they are either releasing progesterone, that is progestate, or levonorgestrel LNG-IUS. has also been introduced. So guys, the devices are either it is an open device or it is a closed device. The device could be a non-medicated. Non-medicated is Lippes loop. Medicated are bioactive. Then you see the hormone containing, two you have to remember, one is progesterone, second one LNG-IUS, levonorgestrel intrauterine devices. Hormone containing intrauterine devices are Coitus 200, Multilode 250, Multilode 375, Coitus 380. So you see two Coitus 200 and 380, but the number wise they have given Coitus 200, Multilode 250, Multilode 375, Coitus 380A, LNG-IUS, levonorgestrel intrauterine device. You can look at the pictures here. This is a Coitus 200T and here it is bent, Multilode 375, again T, Coitus 380A, levonorgestrel containing IUD. The levonorgestrel which is containing the intrauterine device. With this we come to the hormone containing IUDs, we come to an end. Now let us move on to the steroidal contraception. Steroidal contraceptives are oral contraceptives, parenteral contraceptives or device contraceptives. So the steroidal are divided into oral, parenteral and device. Oral could be combined preparation, monophasic, biphasic, triphasic, emergency, postcoital. So emergency conditions after the postcoital, that is after the sexual intercourse, they take oral contraceptives to prevent any unwanted pregnancy. So this is an emergency. During emergency we take oral contraceptives. The combined preparation, that like we saw there was a combined preparation, that was the barrier method. Here the combined preparation will be dealing in the next slides. Monophasic, biphasic, triphasic, emergency, postcoital. As of now you remember this, oral contraceptives, they are combined preparation or a single preparation. The single preparations are progestin only pill, that is a mini pill, estrogen only pill, which is an emergency pill. So guys, you see here the combined preparations are monophasic, biphasic and triphasic, or emergency, which is postcoital. The single, only one hormone, that is progestin only pill, estrogen only pill, one steroid, that is progestin and estrogen. We move on to the parenteral. Parenteral are injectables and implant. The injectables are DMPA, NETEN, combined once a month injection. This is the combined and you take once a month. You see here, I'll show you along with them the DMPA and NETEN. The implants are Implanon, Norplant 2, LNG rod. So guys, injectables are DMPA, NETEN, NETEN combined, which are taken once a month injection. These are the injections, DMPA injection and NETEN injection. Implants are Implanon, Norplant 2 and LNG rod. Now we move to the devices. They are intrauterine devices, that is levonorgestrel intrauterine devices, vaginal ring, that is levonorgestrel ring, combined estrogen and progesterone ring. You see the devices could be IUD, intrauterine device. The intrauterine device is LNG-IUS. The vaginal rings, the rings can be again LNG ring or a combined estrogen and a progesterone ring. Then the last one is transdermal patches. They are Nesterone. So guys, this is about the devices. Again the oral, combined preparation and single preparation. The parenteral could be injections or implants. The devices, they are IUDs, vaginal rings or transdermal patches. Oral contraceptives, the combined oral steroidal contraceptives, it is the most effective reversible method of contraception. So guys, the steroidal contraceptives, orally what the patients take, the pills, these are the most effective because they are easily reversible methods of contraception. And the combination pill, like we saw, progestins and estrogen. Progestins are in the form of levonorgestrel or norethisterone or desogestrel, LNG, norethisterone, desogestrel. So guys, LNG, norethisterone and desogestrel. Estrogen are ethinyl estradiol or menstranol. So guys, you remember in oral contraceptives, it is the effective method, it is a reversible method, it is in the form of combination pill. We have progestins, you can remember LNG in that. Estrogens, you can remember ethinyl estradiol. Some of the commonly used oral contraceptives in India are Mala N, Mala D, Lot and Jasmine. So guys, what are the commonly used oral contraceptives? They are Mala N and Mala D, Lot and Yasmin. You can remember Mala N, Mala D, Yasmin and Lot. Parenteral contraceptives, like we saw, they are injections and implants. Starting with the injectables, they are DMPA, NETEN. The full forms of DMPA are dipomedroxyprogesterone acetate, DM. So dipomedroxy, D depo, M medroxy, progesterone acetate, dipomedroxyprogesterone acetate. NET, NET, norethistyrone enanthate, EN enanthate, norethistyrone enanthate, NET, non-ethistyrone enanthate. Now we move on to the implants. They are Implanon, Norplant 2 and LNG or LNG rod, levonorgestrel rod. You can see the Implanon here. With this we come to the temporary methods conclusion. So let us have a quick revision. We started with temporary methods. There were barrier methods, natural contraception, intrauterine contraceptive devices, steroidal contraception. Barrier methods were mechanical devices, chemical methods, combined methods. In males, condom, females, condom, diaphragm, cervical cap. The chemicals, cream, jelly, foam tablets. Combined were both chemical and mechanical. In the condom, it is made up of latex or of polyurethane. People who are sensitive to latex use polyurethane. This is a widely used method and the most popular brand is Nirod. Females, we saw a pouch. The Femidon, it is a pouch of polyurethane. It is 17 cm. It has a ring at each end. Then diaphragm, it is an intravaginal device. It is made up of latex. They have a metal ring or a spring ring. They have to be introduced 3 hours before intercourse and has to stay at least for 6 hours after the coital act. Vaginal contraceptives, we saw there are foams, gels, creams, tablets and suppositories. The vaginal contraceptive, the most popular one today, what does it do? It will absorb the ejaculate. It will block the entrance to the cervical canal. Again, this should not be removed for 6 hours after the intercourse. We saw the advantages. They are cheap, no side effects, they are easy to carry, simple, disposable, and then they provide protection against 4 things: sexually transmitted diseases, pelvic inflammatory diseases, tubal infertility, ectopic pregnancy and cervical cell abnormalities, and they are useful when the coitus is irregular and infrequent. Then we saw the disadvantages. They can break, resulting in accidental pregnancies. The sexual pleasure is reduced. They might have an allergic reaction. They have to be discarded after each coital act, and the failure rate is also 15%. Then we saw the natural contraception methods, that is fertility awareness method, rhythm method. Then we saw the recording of the previous cycle, and then basal body temperature can be noted. Even the cervical mucus study can be done. We saw the coital interruptus, that is withdrawal method, where the person has to withdraw the penis shortly before the ejaculation. The breastfeeding lactational, a woman who is amenorrheic and also she is like breastfeeding completely, she can be in safe for 6 months and the fertility period is just 2%. Whereas a woman who is partially breastfeeding or she is not breastfeeding, she has to use it in the 3rd postpartum week. She should start using contraceptives. Whereas the woman who is fully breastfeeding, she can use contraception after the 3rd postpartum month. The intrauterine devices, we saw they could be 2 types, open or closed. The devices are non-medicated like Lippis loop, medicated like bioactive. The hormone containing IUDs, that is progesterone and LNG IUS. The hormone were copper T, multilode 250 and 375. Copper T was 200 and 380. LNG IUS. The steroidal contraceptives, we saw the oral in the form of combined preparation or single preparation. Parenteral, injectables or implant. The devices were IUD, vaginal ring, transdermal patches. Oral contraceptives, they are the most effective as they are easily reversible method. They were progestins, levonorgestrel and estrogen ethinyl estradiol. Then we saw the commonly used oral contraceptives Malayan, Maladi, Yasmin and Lot. Parenteral contraceptives were two, DMPA and NET-EN. DMPA, Dipo, Medroxy, Progesterone, Acetate. NET, Nor, Ethisterone, Enanthate. Implants were Implanon, Norimplant 2 and LNG rod. Now in the next video we'll be discussing about the sterilization. Hope the video is clear. If you have any doubts, put it in the comment section, and if you like my video, hit the like button and subscribe to my channel. Thank you.